Hi everybody, so this video is on Kawasaki disease, also called mucocutaneous lymph node syndrome, under the specialist area of paediatrics. Okay, so a few questions to get you started. Question 1. What is the major criteria for diagnosing Kawasaki disease? Red palms and soles, persistent fever for 5 or more days, a strawberry tongue, or red eyes? So think about when you'll want to diagnose someone with Kawasaki, what symptom must always be present? So it's the persistent fever for 5 or more days. Question 2, what is the pathophysiology of this disease? So it's information of blood vessels, mucous membranes, lymph nodes, or connective tissue. So it's blood vessels and it is defined as a vasculitis. Final question. The major complications of this disease affects which organ in the body? Liver, lungs, heart, or brain? So again, think about the previous question, what is the pathophysiology of this disease? And it mainly affects the heart when you get a complication. Okay, so this is just a brief overview of what we'll be going through today. What is it? Symptoms and history, investigations, differentials, and then examination and management. Okay, so Kawasaki disease is also known as mucocutaneous lymph node syndrome. And as I said, it's a vasculitis. Mainly affects children under the age of 5. And it's pretty rare, but you've always got to be aware of it because it can have really bad complications if you don't pick it up early. So the cause is unknown, but it's thought to be genetic and autoimmune mechanisms. And it's the leading cause of acquired heart disease. So this is, as we've just discussed, a complication. Okay, so symptoms you want to look out for. So as we said, the main one, how you will diagnose it, is a high, usually over 39 degrees, persistent fever of 5 or more days. And it will be unresponsive to antibiotics. And this is how you can differentiate it from its other differential diagnoses. Bilateral conjunctival inflammation, so the eyes will appear really red. Mouth symptoms such as a strawberry tongue and swollen and cracked lips. Cervical lymphadenopathy. Erythema of palms and soles. Maculopapular erythematous rash, usually on the trunk, but it can spread. And essentially, it should be considered with an unexplained persistent fever. So red mouth, eyes, palms and soles, and a high fever that's persistent. So history, you want to check for any of these symptoms. As I've said, it presents under 5 years, so you want the child to be in this age range. It's most common in Asian children, and it occurs more in males, and they have to have a fever for 5 or more days. It may have been treated with antibiotics, but these will not have helped, and that's a really key factor. And then these other symptoms that we've talked about. And tempers is a really good mnemonic to try and remember all of these, as it's quite a systemic disease, being vasculitis. So it's a range of symptoms, and yeah, good way to remember that. So the progression, so you have the acute phase, and that'll be 1 to 2 weeks, or without treatment longer, and this is when they have the classic symptoms we've discussed, and then this is when they're at higher risk of cardiac complications. The subacute phase is when the fever starts to settle. Skin peeling as well can occur in this stage, and this is the highest. This is when the platelet count's highest, and you can have the highest risk of sudden death. So you've really got to make sure you monitor these children really carefully. And then the convalescence phase, when the signs and symptoms stop, and you've got to monitor the blood tests, and they'll become normal. And it's usually 3 months. So as you can see, it's quite a long, quite severe disease. So investigations, clinically, as we discussed with the signs, such as these. And then some infants, they won't have all these symptoms, so you've got to be careful of that. And you can treat them based on 3 days. it's kind of better to treat them if you are thinking Kawasaki rather than leave it longer due to complications. Full blood count to show anemia, leukocytosis or thrombocytosis. ESR and CRP, as it's a vasculitis, so these would be raised only during the acute phase. And an ECG, this is really important because of the cardiac complications. So you've got to perform it at diagnosis, repeat 2 weeks, and then 2 months after. And you want to check for signs of myocarditis. So differentials, the staphylococcal or streptococcal infection, because they will have a fever, similar signs and symptoms, but these will respond to antibiotics and you'll have positive cultures. So that's the main difference between all these differentials and then Kawasaki. Kawasaki won't respond to antibiotics and it won't have a positive culture. So again, you may have a similar rash, that's why this scarlet fever can be misdiagnosed, and similar symptoms, but again the culture will be positive. And then also think about systemic juvenile idiopathic arthritis, but they'll also have painful and swollen joints, and they'll be positive for the rheumatoid factor. And note that Kawasaki can develop after systemic JIA. So on examination, you want to look for the symptoms and signs as we discussed. High temperature, look out for cervical lymphadenopathy, the signs that the infant may be presenting with, and then cardiac complications, you've always got to look for this. So signs of myocarditis, shortness of breath, tachycardia and peripheral edema. So the management, it's generally self-limiting, but if untreated, then you get an increased risk of these cardiac complications as we've discussed. You treat it in hospital, as you've got to monitor them really carefully. So the two main treatments are IV immunoglobulins and aspirin. So you want to give both together, and you give a single dose of the immunoglobulins, and its best result is if it's given within 10 days. And aspirin, this is really the only time you'd want to give aspirin to a child, is Kawasaki. So if this is at all mentioned, you'll be thinking Kawasaki. And then you give a high dose of aspirin until the fever stops, and then when it's at its sort of subacute phase, you want to give a low dose to prevent blood clots. So summary, just going over what we've learnt. Which investigation is it most important to repeat after the fever has subsided? So think about the complications of the disease that we've discussed and how you'd want to monitor this. So an ECG, as the child is at risk of myocarditis. Okay, what is the major criteria for diagnosing Kawasaki disease? Red palms and soles, strawberry tongue, persistent fever for 5 or more days, red eyes. So these are all symptoms of Kawasaki, but there's one that has to be present for a diagnosis, and that's persistent fever for 5 or more days. And finally, what is a standard treatment for Kawasaki disease? So think about which treatment reduces the prevalence of coronary artery aneurysms. So 2 of these we've discussed, but there's one mainstay treatment that you just can't forget, and that's IV immunoglobulins, because that's reducing the risk of complications. Okay, thank you for listening. Hope you enjoyed that.